Thank you.
Okay, thank you very much. Last speaker is Dr. Andri, who will present developing of psychosomatic awareness in developing country from Indonesia. Dr. Andri, please.
Thank you very much, Professor Kubo and Professor Sings. I would like to thank to committee who already invited me to come to this wonderful meeting. I also personally thank to Dr. Michael Go as a friend of me, and I would like to thank to be a part of the International Advisory Committee for this wonderful meeting. Today I would like to talk about how to develop psychosomatic awareness in developing country like Indonesia. It's quite rather different with the previous presentation maybe, but I would like to very briefly to talk about this. So I come from the Division of Psychiatry, Faculty of Medicine, Krida Wacana Christian University in Jakarta. I come from Indonesia. You can see from my universe, this is the uniform or the formal suit of Indonesia, and this is the kopia, the peci. It is not related to only religions, but it's also how to, to get to respect the host or the inviter that I mentioned before, that Dr. Michael Go and the committee of ICPM. So this is Jakarta. This is the capital city of Indonesia. And talking about Indonesia, we know that very few people know about Indonesia. When I ask people about Indonesia, do you know Indonesia? No. But do you know Bali? Yes. We know Bali. Bali is here. Yeah. Only a small island, a part of Indonesia. This is the biggest archipelago in the world. The total land area is about 1.9 million kilometers per square, with the total ocean area about 3,257,000 kilometers. The populations in 2013 is about 250 million, divided in 34 provinces and 403 regencies and 98 cities. We just celebrated our Independence Day, the 70th anniversary, this week, 17th of August 1945, we are having Independence Day. So, from the Basic National Health Survey 2013, 236 million populations following the survey, we know that the mental emotional disorders such as anxiety and depressions is 60 million populations, is around 6% of the population. And the severe mental problems like schizophrenia and psychotic problems is about 400,000 people. Unfortunately, in Indonesia, there are still patients with schizophrenia or psychotic that has been shackled. It's about 14.3% of 57,000 people. And this is what do we face in the real daily life activities as psychiatrists, physicians, also related to mental health problems, stigma, discriminations, treatment gap. We know that most of the province in Indonesia, one of the provinces in Indonesia, there's a treatment gap of 95%. So it means that only 5% of the populations that has access to the treatments of the schizophrenia. And also limited access to treatment. We know that we are the biggest archipelago. We have about 17,000 islands in this country, and sometimes the separations of the doctors are not very equal in each island. We don't have any private insurance. Even the government insurance now we are increasing, but there are small numbers of psychiatrists. Also, and only about 850 psychiatrists for 250 million population, it's quite a rather big challenge for us also. And we know that the psychiatric is not a sexy issue to talk about in public. It will be a sexy issue, and when we are talking about psychiatry and in public figure, politicians who have suffer mental health problems, and also the lack of awareness people in mental health issue. But when we see the problems, we can see also the opportunities. So the opportunities of reducing stigma in psychiatric is in the internet use of Indonesia that are increasing in the past 5 years. So this is the preview of internet users in Indonesia, with the total population of 251 million by January 2014. There are about 72 million internet users. There are about 62 million active Facebook users. And for those who are in Indonesia know that we have more than one mobile phone in Indonesia. I have also 3 mobile phones for my patients, for my relatives, and for my colleagues. And this is the average time that internet users spend using the internet each day through the desktop or laptop. It's about 5 hours, 27 minutes per day. And the average day used in the mobile phone is about 2 hours and 30 minutes. And this is the active mobile broadband subscriptions, about 18 million, 0.1. And this is the social media penetration that has 50% of the populations, and they use social media average per day is about 2 hours and 45 minutes. So what kind of social media do you use? Facebook is still the favorite, and Twitter now is following in number 2 and increasing. There are about 29 million active users of Twitter in Indonesia, and it is very quite increasing year by year now, and it's very active. In one survey in 2013, from January to March 2013, there is a posting Twitter about 10.6 billion, and Jakarta, about 2.6% of Jakarta, giving the Twitter. So we're very talkative now, very talkative with the Twitters. So how about their interest in psychosomatic issue? We know they are come from the many background, and if you Google in Indonesia, the language of psychosomatic is psychosomatic, and this is when you are Googling. This is my note in Facebook, my website, and also my blog. We are going to talk about this later. So I conducted a survey for social media related to psychosomatic issue, conducted from January 2015 to March 2015. Most of us know about surveymonkey.com. It's very easy to use sometimes, and then we are collecting data for social media users. And this is the result, respondent characteristic. Numbers of the respondents, 193. Most of them are women. And age range of the respondents are, the most populated one is 21 to 25 years old group, followed by 26 to 30 years old group. It is the same actually as the increasing amount of active users of social media in the regional or in the world. And when we asked about how do you often browsing in social media, they said every day, about 95.34%. And type of social media compared to what the founding in the previous presentations, Facebook and also Twitter, followed by Instagram, now YouTube, also the most social media that we use in Indonesia. And when we asked about health website in the internet, how often did you access to this website in the internet? They said every day, about 41.670%. And when we asked about, do you know the term psychosomatic? They said yes, 87% say yes. But what is psychosomatic with their thing about this term. They say this is the medical conditions that involving mind and body. This is not related to the psychiatric problem. He said that this is different with the psychiatric problem. Some of say that this is medical specialization. Some of them say that this is a subspecialization in psychiatry. But there's also say that there is type of mental disorder. And then when I asked them particularly to access to my website or my work in the internet, they said they are connected to the mental health online consultation in www.healthcompass.com. This is one of the biggest the biggest online media in Indonesia. This is my Twitter. It's very nice to have 16,000 followers now, and it's increasing. And then I posting regularly about psychosomatic, giving attention to public awareness about what is psychosomatic, what is mental health problems, and it is very nice to get more informations about this from also the patient, also from the people, lay people actually. They ask them, and I just only give the general information, not the specific information related to the ethical condition, I think. And this is also, I have a YouTube. We are now on live on Periscope. And this is my website. I bought this link at the website in 2014. This website is like a portal for informations of the psychosomatic medicine. There is a link of organizations. There is also an access to psychosomatic journal like psychosomatic medicine, general hospital psychiatry, and also psychosomatic and psychotherapy. There's only, you can just click here, and then they will come out. And there's also related to events like our event now. It's only on our website. I talked to Dr. Michael Gold, and Dr. Michael would say, please promoting our website in your website also. So this is the online psychiatric consultation. Is one of the biggest online media in Indonesia. I become a consultant here in 2010, and now it's still. And then most of the ask is anonymous. Sometimes they ask about anxiety and panic attack in close place. Sometimes they talk about the somatic or the psychosomatic problems. So I have two books also. One book is for lay people. It's published in 2013, and one serial pocket book, Psychosomatic, talking about dyspepsia, insomnia, and pain for general practitioners, published in 2015. So about the activities in campus, back to 2011, I was awarded by the American Psychosomatic Society to help a psychosomatic medicine interest group in the faculty. And we are gathering students of third years of Faculty of Medicines. We held these activities every month, every Friday at 1 p.m. for 1 year. And we talk about cases, we talk about journals, and the journals we talk about is in the psychosomatic medicines, and also psychosomatic and psychotherapy, and also general hospital psychiatry, because I'm the fellow of Academy of Psychosomatic Medicines, and I have access to this kind of publication, and it's very helpful to understand more about the interactions, mind and body, and also the clinical practice of consultation, liaison, psychiatry. And very proud, this is the first PMMG in Faculty of Medicine in South Asia. So as the conclusion is, I know that Indonesia is a big country with a big populations, and also come with a big challenge. And I think the internet users are increasing and make a potential opportunities for us to educate and advocate people via social media. It's easy, it's cheap, and everybody has access now. It's not limited. Even the speed is still growing up, but I think the penetrations of internet users in Indonesia to health and psychosomatic content is relatively high, according to my survey. And the term of psychosomatic problems is less stigmatized compared to psychiatric problems. When I talk to friends of mine, colleagues also, when they talk about, do you know the term psychosomatic? Yes, I know. When people got many problems with their symptoms of somatic, but cannot find anything about them and cannot find the underlying conditions or medical problems related to this, and this is psychosomatic. And we know that the further research is needed to know the knowledge and perception about psychosomatic disorders. And a friend of mine, Dr. Satri, and my teachers also, Dr. Satri and Dr. Mujadid, also fighting, encouraging how to get more intentions from the formal educations. I come from the public educations, and Dr. Satri and Dr. Mujadid is in the formal education because they are in the University of Indonesia. They teach psychosomatic medicine as a part of internal medicines in the University of Indonesia. And I talked to him very much in this congress, and we are going to build an awareness for both of us and for both of country, to get an awareness, more people to know about psychosomatic. And if you know Indonesia, you will find that Bali is very beautiful country. Not beautiful country. For some people, they said it is a beautiful country, but this is only a part of Indonesia. There's a Kuta beach, it's very, very lovely. And this is also the Ubud in Bali. And if you like diving, you can go to Raja Ampat in Papua. So, thank you very much for your attentions, and I would like to thank also for the committee and for the chat. Thank you.
Ladies and gentlemen, it has been an interesting symposium. It started from ancient wisdom